My name is Carmelo Panetta. I'm an interventional cardiologist here at Health East. I started back in January 2011. My focus is radial interventions, so using the wrist artery rather than the leg artery for doing angiograms and percutaneous coronary interventions. I'm also involved in building the valve clinic here. Eventually we hope to do percutaneous transaortic valve replacements. I was at Methodist Hospital after the University of Minnesota, and then when there was the formation of the Health East Heart Care, I was contacted and asked to help build the program, be a part of the program here, and I thought it would be a real exciting change of life, and offered an opportunity to help build the radial program. And now I'm not the only one who does radial access, which is wonderful about this center, is that all four of us, the interventionalists, do radial arteries, some more than others, but all four of us do radial approach, and consequently that helps build the radial system here, which is actually an important part of any radial program. Working with people where it's a good fit is so important. And I think that I'm very lucky to work with a lot of very bright people. And I think once you start down that path, then it can only attract people who are of a like mind. And so we're very fortunate here to have that ability. So I'm very lucky with the people, the other interventionalists I work with. They're all very, very bright and have a lot to contribute. What I've seen is that it's not just the physicians here that makes it the system that works. That's something that's important to understand. It's a top-down institution. The leadership and administration is very supportive. That's very important. The nursing staff are very supportive. That's very important. The physician staff and leadership is very supportive. That's all of that. That, I think, is what creates an environment that makes it a place where you want to work. And see your career advance. There are a lot of excellent institutions here in the Twin Cities. I'm very fortunate to work here in the Twin Cities. It's become a very competitive place to go to. I'm just happy that I have a position here at Health East where it's a place where we can, like I said, everyone's working together to build a better organization, better for the patients. We wanted to start doing higher risk patients in the cath lab instead of shipping them out to other locations. The first important point I wanted to get across is that the leadership said, if someone's too sick, it's okay, send them out to somewhere else. You do the right things for the patient. And there was no pushback. That's unique. That's actually very, very, it shows a very high level of caring for the patient. And that I can't tell you how important that is. I love my work, but my passion lies at home. The key is, can you get up in the morning, get in the car and drive to work every day, knowing that this could be potentially the last place you're going to work for the rest of your life. And if you wake up in the morning saying, oh, you know what, last night I slept like 3 or 4 hours because my two-year-old was up all night long with a sore throat or whatever. Yeah, it kind of sucks to have to get up and go to work, but it's okay because at least I know there's going to be support there.